Skin is the largest organ in our body. It has several endocrine and immunological functions as well as protecting our organs from external factors. It also serves an important role to express our social and psychological impressions. Along with these functions, we should take some precautions in order to maintain the health of our skin against external elements. Especially elements such as seasons, atmospheric conditions, humidity of the air, harmful rays of the sun cause a number of problems. Seasonal changes in particular result in increased cases of disorders like erythemas, cracking, several skin disorders, acne, eczema, and psoriasis. There are a lot of ways to protect this invaluable organ, and consulting a dermatologist is one of them. Yet this only offers a temporary solution. Generally, whether we have a skin condition or not, we take care of our skin as routine skincare, such as washing and cleaning our skin, moisturizing it and protecting it from the sun, cleaning with a good exfoliator, providing the necessary moisture, and so on. We use a group of chemicals in order to accomplish this. These chemicals depend on the season, patient's skin type, and sometimes financial situation. The most proper thing to do is to wash our face twice a day year-round with cleaning agents that do not contain alcohol or volatile ingredients and is able to foam up. It is important to set cleaning makeup from cleaning skin, since makeup removers contain chemicals that contain volatile or alcohol-based ingredients. These should not be considered as a proper skincare, since the proper skincare is the washing method that we have mentioned and has to be done regularly. Second thing is to moisturize, and the type of moisturizer depends on the skin type, like dry or greasy, seasons like summer or winter, but using a moisturizer regularly is beneficial for skin health. Another thing is protection from the sun, and physically protecting the skin from the sun is the basis of protection. People who reside in locations that are exceptionally affected by the sun should use sunscreen. The brand or the SPF of sunscreens are not relevant, since as long as it has higher than 30 sun protection factors, it will suffice. It is important to note that sunscreen can be applied during summer and winter, and the protection provided is only temporary. Rule of thumb is to apply sunscreen to exposed areas twice a day during winter and 3 or 4 times during summer, approximately once every 3 or 4 hours that we are exposed to the sun. Also, important to note that sunscreen can be applied even when we are not exposed to sunlight, since another benefit is that sunscreen will also help with moisturizing the skin. Other than routine skincare, if there are some underlying disorders such as acne, spots, or elderly spots, then other methods of treatment come into play in order to fix these problems. Applications that reinforce the skin such as PRP or mesotherapy can help with these problems. Another point to note with moisturizing the skin is seasons. Necessities of the skin change as the humidity and heat conditions change during summer and winter. During summer, skin disorders actually decrease. The pores open up, vessels dilate, sun-related problems emerge, protection from sun is prioritized as water-based moisturizing agents can be used. During winter, under harsh and cold weather conditions, oil-based, thicker moisturizers can be applied that contain Vaseline, dimethicone, hyaluronic acid, and glycerin. In excess of routine skincare, we can avoid particular activities that compromise our general health, such as cigarettes, alcohol, lack of sleep, poor eating habits, and air pollution. It would be the best to avoid these harmful things for our body as well as our skin. Adding nutrients such as vitamins A, C, and E, some minerals, or omega-3 fatty acids in our diet would be beneficial. We usually suggest these to be consumed naturally in a diet. If there is a lack thereof, pills or capsules may be used. These will be sufficient regarding skincare if there are no underlying skin disorders. Skincare might require new adjustments by consulting your dermatologist if a disorder is present.